Hi, my name is Joanne. I'm Dr. Lin's medical assistant, and today I have here.
Mary Stapp.
And Mary, how old are you, if you don't mind giving that information?
67.
Perfect. You look great.
Thank
Like
you.
I always tell you. Okay, Mary. So, question, what was life like before your Regenix treatment? What were you unable to do that made you upset?
Basically my everyday walking. I'm a big walker and I, would every morning, as a part of my routine, I would walk. And so I started feeling a lot of pain, in hips and back. And so that started backing off on that, getting various types of treatments. And so anyway, my normal everyday exercise patterns really started to be affected.
Okay. All right. What finally triggered you to come and meet our medical staff?
Well, I had been seeing a chiropractor in California, and she had informed me about Regenix in the California and the Bay Area where I was. And
Okay.
so I did a little research of their facility because of the loss of cartilage in my hip, and because of through X-rays and MRIs, noticeably things going on in my lower back and my SI joints. So I saw an orthopedic surgeon when I returned to Hawaii
Mhm.
and was told that I needed a hip replacement and to make an appointment. And that was last August.
Okay.
So then I decided, oh gosh, I wonder if Regenix is in Hawaii. So thank goodness I found Dr. Lin and his staff and started conversations with them.
Okay.
And the reason I wanted to go with Regenix for these type of injections is because that's what they do. That's their specialty, and getting the best care and the most specialized staff. And what I was looking for, because I still am, and I'm feeling really good about it, trying to stay away from surgery.
Okay.
I may have to have it in years to come, but right now in my life, I'd like to, try to avoid surgery at all costs.
Okay. All right. Did you have any concerns prior to the procedure, Mary?
No, no concerns about the staff, about the process, about anything. No
Oh,
concerns about that. We all have our own personal concerns. I personally don't like shots, so I had to wrap my head around that. So, but other than that, no
okay.
concerns, no reservations.
All right. Thank you. How was the procedure like when you did the procedure with Dr. Lin?
The procedure went very well. It
Okay.
went well. There was multiple injections and a couple little hiccups on my side, but as far as Dr. Lin and the staff, everything was done in a very professional, great. I couldn't say more about it, more positive things about it. It was a very good experience.
Okay. All right. Did you have any downtime after the procedure?
Yes, 2 days after, for sure. There was, a lot of discomfort because of inflammation and just at the injection sites. But I would say after 2, 3 days, I wasn't taking any pain medication.
Mhm.
And, maybe I took a little bit of Tylenol, arnica I took, but overall, I started physical therapy, I believe 6 days later,
Okay.
and that was driving myself to physical therapy and started that up. And, from there on up, things just proceeded to get better as they healed.
Okay. And so how is life like now, Mary, after the procedure?
Life is pretty stable right now, very good. I'm doing a lot of work with muscle rebuilding and strengthening and trying to get my body back into a good, strong shape to hold my bones together.
Okay.
So, life is okay. It's
Okay.
okay.
Perfect. And what can you do that you haven't been able to do in the past before the procedure?
Well, I'm still working up to walking my miles, but I can do 3 miles on the stationary bike. I can do a mile or two on the treadmill, and I could do those back to back. I don't do them every day, but that's part of the training. So I'm just so pleased, and I can play with my grandchildren without groaning and moaning. So
Mhm.
life has definitely gotten better. It's been a positive experience. It's been a long haul, but the body, I'm being patient.
Very good. And lastly, Mary, what would you tell someone considering regenerative medicine?
I would say, please do your research, because that's always good. But I couldn't say more about it. I think it is the future for us. And how can we not accept the fact that our bodies can heal themselves, and we give them some extra tools? And I just can't say enough about it. All positive thoughts,
Thank you,
positive words.
Mary. Alrighty, Mary. Well, thank you so much for your time and thank you for helping us.
You're very welcome. I'm pleased to help. It was my pleasure.
Okay.